Hi, well, my name is Alicia Yamin, and first of all, I want to echo others in thanking the Harvard Global Health Institute and Belinda and Louise and Carissa for all her preparatory work, which was just extraordinary. I'm thrilled to be here, and I'm also equally thrilled to be in conversation with Ana Cristina, who is an old friend, and really this is a chance to hear an inspirational story about building movements. But I also want to take the opportunity, I'm very happy that this comes early in the day because it's the only half hour on reproductive justice. And I want to emphasize that this relates to every other theme that we are going to talk about today. If you care about racial justice in health or health equity, this is at the sharp edge of that. It's not white middle-class women who are dying in this country or around the world. It's disproportionately brown and Black women and persons who gestate and people who are marginalized because of some other axis of identity, rurality, lack of education, disability, caste, etc. If you care about decolonial praxis, this is your issue, right? It is no coincidence that African activists work on reproductive justice, on if, when, and how they want to have children through that decolonial lens, or that the African Commission on Human Rights is the only regional human rights body that has really pushed this issue across the continent, again, through a decolonial lens, or that Ayanna Pressley and Senator Booker, Representative Jen Schakowsky introduced the Abortion is Healthcare Everywhere bill to overturn the Helms Amendment, saying that this was a step toward decolonizing. If you care about community-based practices, there is no better example of accompaniment and community-based practices than in this field. In Argentina, they're called Socorristas en Red, the rescue network. And if you care about even infectious disease control and trust in health systems, as Mandeep said, weaponizing health systems against a large swath of the population and turning providers into a police arm of the state is going to create mistrust and distrust. And then when pandemics break out, we see the results. And the same networks that spread misinformation about abortion worked very actively to spread misinformation about COVID vaccines. So really, in the end, if you care about evidence-based medicine, this is an issue, right? And ultimately, you know, many of us here are related in one way or another to Partners in Health. I work at Partners in Health as well as at Harvard. Paul Farmer's statement about the root of all the problems in the world is that some lives are given more significance than others. This issue is one in which the law explicitly consigns some people's lives to be less significant, for women and other persons who gestate to be less than fully human members of our society. So this is an issue that if you care about health equity and global health equity at all, it is something that we should all have on our radars. And now I'll pivot and turn to what is a really inspirational story about what the Causa Justa movement has been able to do in Colombia, which was an extraordinarily conservative country, and listen to what has been achieved, which is pretty momentous. So why don't we start, Ana Cristina, with a little bit of the socio-historical context and what has brought us to this point.
Okay, many thanks, Ali, for this introduction. I think you said a lot of very important things linked with what we've been doing in Colombia, but also in Latin America, because this is a conversation that is being very strong and, in a way, productive in many countries in our region, not only in Colombia, but also in Argentina, in Mexico, in many different states. We've seen changes towards the liberalization of abortion. And I also want to thank to the school for inviting me to this conversation. But as we have very little time, I try to prepare some bullets so I can stay on time. So I would like to start saying that this is being a long journey, longer than I could ever even believe. But let me start by remembering that it was 1997 when the Constitutional Court of Colombia faced a legal claim asking to eliminate the authority judges had at the time to excuse a woman or exempt the penalty when having an abortion and as a result of rape. Abortion was prohibited at that time under any circumstance in Colombia because we had one of the most restrictive regimes until 2006. But at that time, and although the court didn't change the unfair law, a gorgeous judge named Carlos Gaviria wrote a dissenting opinion. And you may be asking what this is important, is a dissenting opinion. But that was an excellent piece expressing the need to decriminalize abortion and respect women's autonomy. And it was the first light I saw in this long journey. And 25 years have passed exactly from that day where we were like clapping in a room, so happy due to that dissenting opinion. And it came from an essay without any legal effect, but with enormous hope to all of us. And 1 year after that, in 1998, we founded La Mesa por la Vida y la Salud de las Mujeres, where causa justa, just cause, kind of, it sounds better in Spanish, started in 2017 as an initiative that became the movement globally known for having decriminalized abortion up to 24 weeks, transforming Colombia's abortion law in the most progressive of Latin America and the Caribbean, and one of the most advanced of the world. But all this is about building power and building movements. And I'm saying this, what I'm saying with this is that one of the threats of this process is being the political accumulation we have accumulated along these 25 years. At the national level, among many other aspects, through the work of La Mesa, that before deciding to start Causa Justa, worked for almost 15 years on the implementation for the indications regime established in 2006, the first time that Colombia partially decriminalized abortion in our country. And we decided that we wanted to make that decision a reality in women's life. We did a lot of accompaniment to women. We were able to identify barriers. We were able to gather evidence, but we also produced interpretation for those indications because we knew from other experiences that that regime really didn't mean for women real access to services. And
can I just stop? Some people may not know or be familiar with the use of the term indications regime.
yeah,
Although
legal
that
grounds.
is what we increasingly have across this country. But maybe you could explain, or I can.
Go ahead.
So unlike the Roe v. Wade gestational age determination, indications regimes, which are very common throughout, the most common really around the world, are that abortion, there's a default of criminalization except for to protect the life of the mother, to protect the health of the mother in cases of rape or incest. So those are indications in which there is a legal claim to a right.
Exactly. And we had one of the most comprehensive indications regime because it included in cases, the possibility to have an abortion in cases or to protect women's life and health, not depending one of each other, in cases of rape and fetal malformation. So we did a lot of work to expand the interpretation of those indications or legal grounds for legal abortion. And we identify barriers as well as the need that we started to see to litigate for guaranteeing access to abortion services. So although we had this regime, we were still litigating to help women to access abortion services. And the work we deployed to train doctors at the national level also to help them to interpret each of the indications for legal abortion comprehensively. And all that allowed us to build enormous credibility, and we became nationally recognized experts in the field, but also we built relationships with authorities, with politicians, and with other movements. Not to mention that this political accumulation came too from our extensive work with colleagues in Latin America more broadly, where we imported, among others, the green scarf, and I'm so sorry I don't have mine, is in my table, I can ensure that. Or to where we exported the strategies to advance the oldest and more spread abortion regime from our region, which is exactly the indications regime. And with all these in our hands, and tired to be reacting to attacks from the anti-rights movement, I don't have to explain that here, we decided to open a public conversation in our, I like to say this, aspirational and inspirational terms, and to promote an adaptive change, creating and sustaining the public discussion we wanted to have, with the idea of positioning a critique of the use of the criminal law as a way to regulate abortion. And that's how we started this movement in 2017.
So maybe you can talk a little bit more about the movement building, since we've already introduced the need to build power and work through coalitions.
Yes, we've been doing, I can say this, most of my work has been done through networks and organizations inside the feminist movement in Latin America and in Colombia. And from La Mesa, most of our work has been also done with other organizations. So we work a lot in collaboration. And I think that the feminist movement, and I'm pretty sure about saying this, is by tradition an internationalist movement. So we've been like having encounters, meetings in Latin America the last 50 years. Every 3 years we met to strategize, to discuss. But during the first years, I told you that we started this idea of causa justa in 2017. But the first 3 years in La Mesa, we worked on developing the arguments we wanted to use for that public conversation, because we wanted to open a public conversation, and we need arguments, we need ideas to engage much more people around this, but also design the strategy that we were going to deploy, including a legal process that considered many different options for when the time came to transform the conversation into a concrete legal action that could allow us to repeal abortion crime from the penal code, changing the regulatory paradigm until that time used in most legislations around the world. Because this is not only in Latin America, this happens basically everywhere around the world. We developed 90 arguments for different audiences. And some people ask, 90 arguments? How are you gonna campaign with 90 arguments? But we wanted different type of arguments to engage different type of people. So we developed arguments from the public health perspective, from the international human rights standards, arguments around citizenship, around the peace process, around democracy, around secular state. How do we say we live in a secular state that is dominated by these kind of policies? And from the strategy, which is a very comprehensive strategy, I just wanted to emphasize here that at least 3 critical pillars. One is the political communications. We started our social networks. We started a lot of work with the media, traditional media, but also street mobilization, which we learned from Argentina and other countries. It's just to look at the pictures and you see what we were doing on the streets. But also we did a lot of pedagogical work. We did one by one or group conversations or seminars or courses with leaders, with opinion leaders, with politicians, with actresses, with ask me who, singers, public figures, even the current Minister of Justice. We have photos of him here with the scarf, and the current Vice President of Colombia. We had those kind of conversations from 2020 when we launched the movement. But the third piece, which is the most important related to her question, is that we worked since the first day. We call all the organizations from the country working in reproductive health, but also the human rights organizations, and women, youth organizations, indigenous, rural, to work together. And that's how the initiative became a movement that today is composed by more than 130 networks expanded in more than 20 cities in the country that organically are part of the Causa Justa movement, plus thousands of individual politicians or opinion leaders that took the cause and started to defend it and to talk about that in many, many different places. So, as I like to say, our networks are sacred. And I'm going to explain why I'm using this term that seems to be so religious. Because strengthening and building networks as well as collective work is the engine for sustainability. But when I say that our networks are sacred, I mean that they're worthy of devotion, or in other words, of the respect those deserve for what they represent and remind us, which is that together we can meet goals, we can solve problems for concrete women, we can find a space to protect ourselves, and even face the fact that abortion, as the cultural battle of this century, is something that we can fight together and something for which we need each other as a movement.
That's really incredibly inspirational. So I want to just underscore a couple of things from what Ana Cristina just said, which is one, the networks and embedding abortion struggles in broader movements, and two, the long historical iterative work that this has taken and the emphasis on social decriminalization before we talk about the legal case that they brought. And the third thing is what she mentioned in passing, which was the connection among different countries in the region, because the so-called green wave with the pañuelos verdes that began in Argentina in 2020 with legislation and then moved to Mexico and then Colombia in 2022, really is a product of a lot of connected struggles across the region among lawyers and human rights advocates, as well as physicians and providers and activists that have all worked together. And in the United States, we might take a few lessons from them. I do want to turn to the legal claim itself in that Causa Justa brought.
Yes, and I also want to emphasize very, very quickly what you said, because when we started this, I told you that we worked during 3 years, like for among us, developing the arguments, the strategy, but we launched the movement in February 2020. And that's when we started to do all this pedagogical work with so many people. And after 2 years after, we measured with what happened with the digital conversation around abortion. And we saw that our terms, our arguments dominated, and I don't like to use that word because it sounds like terrible, dominated in the sense of statistics, all the conversations. So we changed a conversation that used to be, we need someone against, and someone in favor, and that's how we are going to talk. But because people really wanted to understand what we were saying, what is this? Do we have a crime? Oh, we didn't know we had a crime. And many people started to ask those kind of questions, and including some very conservative people started to say, well, but we already have the indications. Previously, they were against the indications regime, but then when they saw we were growing, they said, we already have this is so good, this is very important. And people moved from the indications to the idea of repeal abortion crime from the penal code, which was our legal claim. So as I've mentioned, it was essential to design a strategy, but to be flexible. And very soon after we opened the public conversation in February, as I told you, we saw a window of opportunity in the Constitutional Court. Then I can explain you what was the window. And we decided to file a claim asking the court a very simple thing, to eliminate the abortion crime from the penal code, leaving to the health authorities the mandate to regulate outside the criminal law. So we developed 5 or 6 main legal arguments based on those 90 arguments, on the idea that the crime operated as the structural barrier that women faced when they tried to access abortion services, and that the use of the criminal law should be the last resource to regulate a health service, as there were other ways to protect women's rights and also gestational life. And due to that significant barrier, women's rights to health, equality, and freedom of conscience were being violated. And we also developed in that legal claim that the same thing was happening with the right to exercise the freedom on the medical profession or the secularity of the state. And it took the court 523 days to make a decision. During those days, we were doing that pedagogical work that I explained. We were doing social media, and we were in basically all the media in our country, but also internationally, as you can see in the pictures. We didn't stop 1 second, because this is the only way to continue building power while you are doing something that is pretty much technical inside the court. You need to mobilize and keep the conversation going on. We also promoted expert testimonies or amicus from national and international experts like Alicia. She also gave an extraordinary amicus, but we got more than 114 amicus curiae from international and national experts, former ministers. Nothing of that happened by chance. We did all the work behind that kind of things. And we always kept, and this is so important for me, our final goal in mind, no matter how much we got pressured or faced uncertainty. Because at some point, 500 days, people started to ask, shouldn't you say to the court that they might maybe just give you 14 weeks of pregnancy and establish a time limits regime and that's it? And we said, no, we are here talking about a change in the paradigm. Let's see the court, they are gonna do that maybe, and they did it. And that's how Causa Justa legal claim ended in a landmark decision, which is have a number, CO55 from 2020, by the Constitutional Court of Colombia, that established that abortion shouldn't be a crime when performed before 20 weeks of pregnancy, and that in all cases after that time limit passes, the crime won't be applied to the 3 exceptions to the crime that already existed from 2006. Additionally, the court urged Congress and the national government, without prejudice to the immediate effect of that decision, to formulate a public policy. So that's how it happened. And the decision of the court, there were other legal, more complicated arguments, you know what I'm talking about. But the court at the end says they recognize that due to the crime of abortion, women's rights to health, equality, and freedom of conscience were violated. And it was so important because now this decision is like rooted in very fundamental principles of our Constitution.
So it is an extraordinary judgment and an extraordinary paradigm change and achievement. But it was a 5-4 judgment, and interestingly, for feminists, only one of the female justices voted in the majority. And now, you know, it does face extraordinary challenges in terms of implementation and the design of public policies. It wasn't accidental that you went to the court instead of to Congress initially. So maybe you can talk about, you know, the judgment as an inflection point, but not as the end point of this struggle.
Last year in February 2020, after the court released the decision that we call Causa Justa decision, many people asked me if that had been the most important day of my life, as we had accomplished something incredible and were ready to rest. I did laugh. Conquering a right so contested in our societies is just the beginning of new challenges. And remember that once you reach your goal, a new job starts. Even my partner asked, so you're now free? And I was, no, I'm not free anymore. So after the judgment, we have many challenges, but we have like grouped those challenges around 3 fronts of work. The first one is the implementation of the judicial decision. We need that decision to become something that make a difference in women's life. For that, we need to work with the health system. We have a strong health system, although many people don't consider it's strong, but most of our population is insured. And we need to ensure that those women get services through our health system. But if they don't want, we also need to ensure that they can have a self-managed abortion. So we need to work a lot in training doctors, in changing the way in which implementation has been done. And we have some data that showed us that after 1 year of that decision, because we in La Mesa accompany women that face barriers when trying to access services, that the need of litigations fall 30%, which is a lot. So now our health institutions are providing services much more than 1 year before.
So let me just explain that. In Colombia, in the legal system, there is a writ mechanism where an individual can bring a claim to court that has to be resolved within 10 days. So it's not the way our legal system here works and challenging abortion restrictions.
Yeah, but it was that resource and many other, legal resources that we had to use in order to make those institutions to provide services. So implementation is in the core of our work, but the second one we have called the protection of the decision. And I don't have to explain you that we've learned from Roe versus Wade in the US that a judicial decision is legally and politically vulnerable. So we've been doing a lot of work on that. Yes, I'm pretty aware of the 5. We also have to, now, for example, we are facing 17 nullity requests to the court to annulate the decision and many other things. Every time that something happened, the anti-rights, they sued that decision. So that's how it works. And the last one, which is the social decriminalization, the most important for us, because it means making the judicial decision sustainable through social and cultural changes. And to get into it, it is necessary to continue talking about abortion publicly and being responsive to every conversation to that, so that one day people's hearts and minds will change profoundly. Everyone must learn that this is a peaceful decision, and I love to say this because it allows every woman to be or not to be a mother based on the reasons and departing from their moral integrity and the recognitions that women are, full moral subjects. Ultimately, all this is about building legitimacy on women's decisions and making the change sustainable in time. In many ways, we changed it. One of the most challenging conversations of our time, and did it in our terms. After 1 year, we continue being part of the headlines, highlighting words as freedom, historical year, 1 year of more autonomy for women. It didn't happen. I can assure you that in our media. And that happened in Colombian leading journals, podcasts, TV, radio programs. But nothing, and I'm gonna end with this, nothing of this would be possible without the movement and the power we build, without causa justa fighting every time and every second needed. Society today knows that a crime like abortion is unfair, is inefficient, is counterproductive, is discriminatory, and I would add, obsolete. And society also knows that without that crime, we can celebrate women's freedom, lives, health, and dignity, that women can choose how to live and pursue the life they dream for them. And in such a way, we will become a much better society, a society that one day will ask itself why that crime ever existed. And we will just wholly and definitely delete it from our penal code.
Thank you so much, Ana Cristina. So reflecting from the United States, I think I hope that we can follow the inspiration of Casa Justa and the other countries of the Maria Verde, Argentina and Mexico. This is a democracy question as well as all of the others that we've raised. You know, who gets to have power over who and of what kind, and who gets to decide whose life plans mean something and whose don't. So I hope you continue to think about this throughout the course of the day and much longer, and take advantage of having a really inspirational leader here to talk to and learn from the experience in Colombia.
Let me add something very little. I know what I'm gonna say sounds controversial, but you know, the earth spin around, and maybe this is time to look to the global south and learn from our experiences, strategies, and arguments. And I say this with humble. So thank you so much.